Assisting a patient with turning in bed. Good day, learners. This presentation will deal with assisting a patient to turn in bed and will assist in your preparation for assessment. Patients who are forced into inactivity due to illness or injury are at risk of developing immobility complications. In order to prevent these complications, frequent position changes are essential. Care providers should assist these patients with turning and mobilization as required. The use of correct body mechanisms will assist in reducing the risk of injury to the patient and the care provider. Purpose: assisting a patient with turning in bed is a generic basic nursing care standard to be mastered by all learners. Learners skilled in the standard will be able to promote patient comfort and prevent immobility complications. Specific outcomes: learners who have been assessed and found competent in assisting a patient with turning in bed will have achieved the following specific outcomes and will be able to apply the correct body mechanisms throughout the procedure, perform the procedure without injury to the patient or to oneself, and record and report any abnormalities correctly. Embedded knowledge. Embedded knowledge represents what you as a learner has to understand and be able to explain in an area of learning and at a particular level. You as a learner should have mastered all the theory related to patient activity and mobility. You should have sound knowledge related to the anatomy and physiology of the musculoskeletal system. You should also have sound knowledge about back safety. You as a learner should understand the medical legal aspects regarding the safety of a patient, and you should have attended a demonstration in simulation on the safe techniques to reposition a patient in bed. Range statement. Assisting a patient with turning in bed is a generic basic nursing care standard, and learners can be assessed in their field of learning in line with subject matter expertise. Procedure. This procedure will be performed according to the nursing process. Assessment. Identify the patient. Greet the patient and introduce yourself. Ask the patient to state his or her name. Check the patient's name and identification number on the patient's identification bracelet. Compare the patient information with the patient's records. If the patient cannot identify him or herself, verify the patient's identification with a second staff member who knows this patient as a second source. Explain the procedure to the patient and obtain the patient's permission. Check the patient's medical records for any conditions or doctor's orders that may limit patient mobility. Appropriate nursing diagnosis may include the following: activity intolerance, risk for injury, fatigue, acute pain, chronic pain, impaired skin integrity, paralysis, and post-operative immobility. Assess for any medical equipment or surgical procedures that may alter the positioning procedure. These may include the following: intravenous lines, drainage tubes, oxygen therapy, or incisions or wounds. Assess the patient's ability to assist with the procedure. Identify the need for a second or third care provider to help with the activity. Assess the patient's pain level. If the patient experiences pain, report it to the registered nurse. If any analgesic medication were given, allow sufficient time for it to take effect before moving the patient. Planning. Assemble the following equipment: clean gloves, a clean draw sheet, additional pillows and other support aids, for example, ring cushion or pressure relief aids. Place pillows or other support aids to be used within reach. Prepare the environment by closing the curtains around the bed and closing the doors to the room if possible. Implementation. Perform social hand hygiene. Adjust the level of the bed to an appropriate and comfortable working height. Adjust the head of the bed to a flat position or as low as the patient is able to tolerate. Put on clean gloves if expected to touch bodily fluids. Move to the opposite side of the bed. Lower the side rail nearest to you. Open the top linen by folding it to the foot end of the bed. You will move the patient to the edge of the bed using the draw sheet. This is done as follows. Fan, fold or roll the draw sheet close to the patient's body and grasp it securely. Stand with your legs shoulder width apart, with one leg slightly in front of the other. Bend your knees, keeping your weight on your front leg. Pull the patient towards you by shifting your weight from your front leg to your back leg. Watch the patient for signs of pain throughout the procedure. Stop if the patient experiences severe pain or discomfort and reassess your approach. Raise the side rail and move to the opposite side of the bed. Lower the side rail. Ask the patient to cross their arms over their chest and to cross the leg furthest from you over the leg nearest to you. Stand in line with the midsection of the patient, with your feet spread about shoulder width apart, with one foot in front of the other. Position your hands and forearms on the patient's far shoulder and hip to roll the patient towards you. Tighten your gluteal and abdominal muscles and flex your knees. Roll the patient towards you as you shift your weight from your front leg to your back leg. You may also use the draw sheet to gently pull the patient onto his or her side. This technique is done as follows. Grasp the draw sheet on the opposite side of the patient and hold it close to the patient's body. Gently pull on the sheet as you shift your weight from your front leg to your back leg. Watch the patient for signs of pain throughout the procedure. Stop if the patient experiences severe pain or discomfort and reassess your approach. Assess the patient's skin for signs of irritation, redness, edema or blanching. Pull the patient's shoulder blade forward and or out from under the patient. Make the patient comfortable and position them in a proper alignment, using pillows or other support aids. Tidy the bed linen and ensure that it is grease-free. Cover the patient with the top linen. Raise the side rails. Elevate the head of the bed as needed for comfort. Thank the patient for their assistance with the procedure. Provide grooming if required, for example, brushing of hair. Remove your gloves and discard it according to the internal policy of the facility. Perform social hand hygiene. Lower the level of the bed. Place the call bell and other necessary items within the patient's reach. Evaluation. The expected outcomes are met when the patient is turned and positioned without injury to the patient or oneself, and the patient demonstrates proper body alignment and verbalizes comfort. Record keeping. Record the procedure on the patient's turning chart or progress report. Indicate the position the patient is in, the use of support aids, and the condition of the patient's skin. Also indicate the patient's tolerance and pain level throughout the procedure. Remember to write the date and time and to sign the entry. Unexpected situations and associated interventions. If during the procedure you realize that you need assistance, you may use the call bell to call for assistance. Alternatively, you can raise the side rails and cover the patient to go and call additional care providers to assist with the procedure. Always inform the patient of your actions. In cases where the patient receives oxygen therapy or has an intravenous line, a drainage tube or urinary catheter in place, great care should be taken during the procedure to prevent pulling on or dislodging of tubing, which may cause injury to the patient. The drainage tube should be temporarily clamped to prevent backflow of fluid. Move any tubing, lines and collection bags with the patient during the procedure. Remember to unclamp the tube after completing the procedure. In conclusion, the caregiver plays an important role in providing comfort for the patient. Adherence to infection control guidelines is important to ensure that all care is safe care. Perform your tasks as per this lecture and to the best of your ability, always keeping in mind your scope of practice.